The state government has reiterated its commitment to providing quality and accessible healthcare for all residents of the state. The Director General and Chief Executive Officer of the Delta State Contributory Health Insurance Commission, Dr. Isaac Akpoveta, gave the assurance today while addressing over 200 pregnant women and under 5 children who came to register with the Commission in line with the Commission's new policy for the Equity Insurance Plan. Dr. Akpoveta said the Commission had announced its pre-antenatal registration policy for every pregnant woman in the state to ensure proper record and accountability of patients under the scheme and to curtail the invasion of public health facilities by pregnant women from neighboring states who come in at the point of delivery to enjoy the free health scheme meant for residents of the state. He said the large turnout of pregnant women to the Commission for the registration was a pointer to the importance of the Equity Health Insurance Plan to the people and how much they had embraced the more agenda of Governor Sheriff Oborevwori, noting that the mass registration was happening simultaneously in all public health facilities across the state. He noted that Delta State remained the only state in the country where the Equity Health Plan was working in such magnitude, attributing it to Governor Oborevwori's support to the Commission and dedication to ensuring no woman died while giving birth.
Change policy in order to make the antenatal system under 5 system we call the equity plans work more effectively and more efficiently. We change the policy, and the policy is number 1, every pregnant woman in the state must register before attending clinic, and they must attend clinic regularly so that they don't have problems when they are going to deliver. Number 2, they must also would help us to show that they are from Delta, because we realize that people are coming from across the borders to come and enjoy the free antenatal and child care in Delta State. The volume of money the state has spent on this is very huge. We have to curtail this invasion of our health facilities. So today is the second day or the third day of the policy, and there was a crowd of antenatal patients at the Ash Specialist Hospital. And then they couldn't cope with registration there, and they come to the headquarters to register. You have the big number of them, probably up to 200 that came here today. And within 30 minutes to 1 hour, we have registered them. So it's a great thing. It shows that people have come to realize that the Governor Sheriff under 5 and pregnant women, what we call equity plan, is needed, is required, is important. And people are taking interest in it. Our pregnant women are taking interest in it, and they are registering en masse to ensure that we have a proper record of them. This is the third reason that we must want to have a proper record before they just walk into the clinic without registration and they take care. But it's not proper in health insurance. Health insurance you must pre-register. You must register before you take the care. And so they have registered now, and they are registered across the state. What you see here is what is happening all over. Central hospitals, zonal hospitals across the state. Warri, Ughelli, I've just called them now, Okwe, and so on. A similar thing is going on, meaning that our women are embracing the Sheriff More agenda to ensure that we don't have any woman dying in pregnancy or having a morbidity in pregnancy. No child is lost after 9 months of pregnancy, and no child under 5 will die in Delta State. Delta is the only state, and I repeat, only state in Nigeria that have this program. Free, walking, just get a card and you receive free care. I think we must thank our governor. Now, I also want to mention here that my record shows that the state government have paid close to 13 billion, more than 13 billion, into the hospital system through the Health Insurance Commission for the care of under 5 and pregnant women in the last 9 years. And again, only last month, His Excellency the Governor, Sheriff Oborevwori, gave us 1 billion and released 100 million every month for the care of the equity, pregnant women and under 5. Only Delta has that record. And I'm very sure other states will start emulating it very soon. Even if the federal government just announced recently, oh, we start having free cesarean section for pregnant women. Something we've been doing for the past 20 years in Delta State, and then we've been doing since this government came into power. So I'm happy what is happening today. It shows that people are embracing the more agenda of the Oberewori so that Delta can have what we call more health for all Delta.
The women described the registration process as stress-free and thanked the governor for taking care of their financial burden from pregnancy to delivery through the scheme.
I know how much you said just the scan and every other thing that the pregnant woman should go through before delivering. And
our governor Sheriff, we thank him for everything that he has done for the pregnant women, for making everything free for us.
It would be recalled that the Commission had announced that without a health insurance card, no pregnant woman will receive free treatment in the state. Eunice Emeazia reporting.